Hi, I'm Brigid from Melbourne, Australia, and I'm a specialist in preparing for the OET and IELTS exams. So you're getting ready for the OET speaking subtest. In this explainer, I'm going to break it all down for you. We'll cover exactly what to expect, how you're graded, and more importantly, how you can do really well. So you're probably feeling a bit nervous about the big test, but often that's just to do with the unknown. It's completely normal, so don't worry. So our goal here is to make it all a lot clearer and way more manageable for you so that you can practice. So here's what we've got on the cards for today. We'll start with the format of the test. Then we'll look at how you actually scored and we'll cover some common mistakes to avoid. We'll focus on some simple tips for success and then we'll put it all together. Sounds good? All right. So, section one, the format. Let's work through it step by step. Format is the key because once we're comfortable with the format, we won't feel as nervous on the day because we'll know what to expect. It's the best way to feel confident and in control when you walk in on the test day. So, the whole test takes about 20 minutes. And it's designed to feel really practical and to be just like the conversations you'd actually have in a hospital or a clinic, which is great because it means the skills you're practicing for the test, you're going to use them every single day in your career. Okay, so the process itself is super clear. It starts off with a quick ID check and then a little warm up chat. The warm up's not assessed, it's just to help you get settled in. Then you'll be given your first role play card and a pencil to make notes, and you have 3 minutes to prepare, and it will be followed by a 5-minute role play. And then the process is repeated 3 minutes for your second role play to prepare, and a 5-minute role play again. Different to the IELTS exam, the person sitting next to you in the role as the patient or guardian is not your examiner. They're an interlocutor to run the role play with you. So they don't score you. Your actual test gets scored later by 2 or more trained OET assessors who listen back to the recording. So it means you can just relax. You're not trying to impress the person opposite you. The assessment criteria gives you the mindset of the examiner so you perform well in your exam. The OET speaking exam is a patient centric exam. It's not just about your English, the linguistic criteria. You'll also be assessed on your ability to communicate successfully in a clinical environment. Your English language skills are called the linguistic criteria. And the key is whether you can easily be understood, including your pronunciation, your stress and intonation and rhythm. And they are looking for fluency. They will be looking at whether you are speaking at a normal speed with just a little repetition or self correction. They'll also look at whether your language is appropriate and you're using the right vocabulary for the context. Finally, they're looking for a rich and flexible range of grammar and expression. Now, on the clinical side, this is really where you get to show what a great professional you are. It's about building that relationship with the patient and really trying to understand things from their point of view and giving the conversation a clear structure. And of course, being good at gathering information from them. You need to give information back to them clearly, and you may need to clarify or answer further questions from the patient. So, these are all skills that make all the difference and make you an excellent health professional. So, for clinical communication, they're going to look at A, indicators of your relationship building, B, understanding and incorporating the patient's perspective, C, that you've provided structure, D, information gathering, and E, information giving. So the clinical grading, the score is from 0 to 3. 3 is outstanding. Adept means you've absolutely nailed it. 2 is great as well, competent. It's a very strong performance. You want to make sure you show all these skills consistently through the role plays. Okay, next up, some common mistakes to avoid. Sometimes knowing what not to do is just as important as knowing what to do. I can't cover them all in this video, but let's go through a few common little mistakes. What to avoid? The first one is interrupting the patient. Many candidates do this because they're concerned they won't get through the role play tasks. You don't need to get through the role play tasks. Active listening is very important. The second one is don't use leading questions where they answer yes or no. So you want to avoid medical jargon too. Keep your language simple and clear. A leading question is something like, you don't have any pain, do you? It kind of pushes them to an answer. Also, don't ask two questions at once, as it can be quite confusing. Okay, enough of what not to do. Let's talk about some simple tips for success in your exam. So the first tip is walking in prepared, knowing the marking criteria, particularly effective communication in a clinical session. And then the key is practice, practice, practice. If you go to my link, I'm happy to help you set up a program with a couple of sessions where I can provide you with feedback. Some other ideas for you. Use signposting. This helps guide the patient through the conversation. You can say things like, okay, first I'll ask you a few questions, then we'll discuss a plan. It's really helpful to the listener. Listening actively. Make sure you're paraphrasing and confirming what the patient says, and use open questions. Follow-up questions on what they've said recognizes that you have been listening. You can also use a phrase, does that all make sense? But I would only use that once. Don't repeat, do you understand? Do you understand? Use different techniques. Okay, let's put it all together. The role play card. We've talked about the format, the scoring, the tips. So how does it all come together? Well, it comes together with the role play cards. So before the two role players start, you're going to be given something called a role play card. Think of this card as your map for the conversation. It has absolutely everything you need to know for the next 5 minutes. So what's on this card? Well, it clearly tells you the setting. So you know if you're in a hospital or a local clinic. It tells you the setting and also the situation. That's the background, why the patient has come to see you. And most importantly, it gives you a list of tasks. These are the things you must cover in your conversation. Your goal is straightforward. Carry out the tasks on your card to the best of your ability. The real focus, though, is how you do it, confidently demonstrating your English and your clinical communication skills. So as I wrap up my overview, what's the single most important thing that stands out to you about the OET test? My message is it's a test of your professional communication skills that just happens to be in English. It's about showing you're a great communicator and a great healthcare professional. Remember, the more you practice, the more confident you'll feel. Join me to practice your test online with guided expert feedback. If my video is helpful, give it a like and subscribe, and I'll make more English exam skills and strategy videos. Thanks.